ladies and gentlemen. First of all, I would like to introduce. Sorry, I got trouble with my mouth. Dr. James DWYER to you, and he's now the Fulbright visiting scholar in Taiwan University. So it's our privilege having this opportunity to invite him over. And this has been the second time we have such a precious opportunity to invite him to give the speech on the campus of National Tsinghua University. And the speech indeed is sponsored by the honorary lecturer of the Xinyi Jiangzuo, and which means that James is a very sort of outstanding expert in the field. And last time I had an opportunity to go through the whole course and participate in the class discussion, and I learned very much from him. And I believe that you will feel it in the same way today too. So I try to save some more time for the presentation. So let's welcome Dr. DWYER.
Thank you very much. It's an honor to be here. It's a very famous university, and it's my second time to come here, so I'm very happy. Last week, I gave a lecture about some ethical issues that are important in research, but also in clinical practice, in business, in research. And that was about the ethics of speaking up. But we decided today that we would analyze two cases. One case I would bring, and one case came from Taiwan. And that instead of a lecture, there would be more participation. So that's the plan tonight. I will present a case, we will analyze it together, we'll take a short break, and then we'll present a second case, and we will analyze it. And I will compare your analysis to what people in the United States tell me, so we can do a little comparison. But before I begin, it would help me to learn a little about you. So I'm going to ask just simple questions. How many of you are students? Okay. And what do you study? How many study law or related, something to law? Many. And you study information?
MIS, Information Management.
You teach and work at National Central University.
No, I graduated from National Central University.
Oh.
And then I'm now working at the China Medical University, Taichung.
Okay. Well,
Major in philosophy.
okay. Well, welcome.
Thank you.
Did I miss anyone? I'm sorry, were you a law student? Oh, okay, here. Yeah. Okay. A short introduction to myself. When I was in high school, I was interested in many different things, including subjects in school, but I was interested in basketball, and I was interested in girls, but all boys are interested in basketball and girls. But different, I was very interested in religious questions, and I had a very mathematical mind. So I won the mathematics award in my high school. So when I went to university, if you're interested in religious questions and you have a mathematical mind, you end up in philosophy. So I ended up studying philosophy. But most philosophers I saw, professional philosophers, they just talked to other philosophers, and they wrote in journals that only philosophers read. And I didn't want to do that. That's not why I went into philosophy. So I began to work in medical ethics, bioethics, the ethical issues surrounding medicine, biotechnology. And that was very good for me because I was working with people who were actually engaged in the field, and we could discuss ethical issues like we will do tonight. So I decided not to teach in philosophy departments directly, but I taught mostly in medical schools, like my colleague here. So I taught in the United States at New York University, which is in New York City, and then University of Pittsburgh. They do a lot of transplants at University of Pittsburgh. So we'll actually see a case tonight. And then I taught at Upstate Medical University. Okay. So let's begin with my plan. I'm going to present the first case, and then together we will analyze the ethical issues. So in your packet, there's a loose sheet. And if you didn't get one, we will give you. Now, the issues are real, but the case story is made up. So it's not me in the case study. But I will read it, and then we will analyze it. I think I'll put the microphone down. Can you hear me if I just read it? Okay. Part of my liver. My ex-wife called and asked if I would give her part of my liver. I asked if she could wait until I died. She said that would be too late. I was in good health, and she needed a liver transplant this year. Please, Frank, she said, I'm not asking you to decide right now. Just take the blood test to see if we're compatible. Okay? The doctors do a blood test to see if it's matched. Marie, I said, 20 years of marriage prove that we are not compatible. I'm not talking about that, she said. I'm talking about our blood types. All I'm asking is for you to take the blood test and to talk to the transplant team. What could I say? I said I would, and I did. I took the test, talked to the team, and read a lot. I did my homework. The first thing I learned is that a liver is not a kidney. You have two kidneys. You can donate one of them and live quite well with the other one. Lots of people do it. It's no big deal anymore. The doctors remove one of your kidneys, and in 2 or 3 days, you're back at work. You can resume a normal life, except for kickboxing. Livers are different. You only have one, but it can regenerate itself. If the surgeons remove part of your liver, it will grow back. So that's what they do. They cut out half of your liver and implant it in the recipient. To make things work, they need a living donor with a good liver, a recipient with a bad liver, 2 adjacent operating rooms, and 2 sets of transplant surgeons. While the surgeons in one room are cutting out half of your liver, the surgeons in the next room are cutting out the recipient's liver. Then your surgeons pass the good piece over to the other surgeons who hook it up in the recipient. Each operation takes about 8 hours. If things go well, you recover slowly. When you wake up, you have a ventilator tube in your mouth, a catheter in your bladder, a feeding tube in your stomach, some kind of drain in your abdomen, and several intravenous lines stuck here and there. If there are no complications, you need 6 days in the hospital, 3 months off work, and lots of home care. If things don't go well, you die. How often does that happen? I asked the surgeon. Although we have to quote a mortality rate of 1%, he told me, we think the actual rate may be as low as 1 in 200. As low as, I wanted to say. Think about it. 200 people are sitting in a theater watching a movie. One of them doesn't go home. The janitors sweep them up with the paper and the popcorn. I know all this because I did my homework. I read a lot and I talked to a lot of people. But no one I talked to could tell me what I owed my ex-wife. Divorce lawyers know about legal obligations, alimony, child support, common assets, and things like that. Hospital ethicists know about moral obligations, duty to prevent harm, duties to assist, obligations based on relationships, and special obligations based on family relationships. But who knows about my relationships? I love my wife. That's why we got married. That's why we had a child, a lovely daughter named Sophie. Everyone said that Sophie looked just like her mother, big, intelligent eyes, long, athletic limbs, and light brown hair with 4 shades of red. But it was kind of a long time before I saw the resemblance. Kids grow up fast. They crawl around, they learn to walk, play soccer, do homework, and go off to college. The part I liked best was helping Sophie with her homework. We went through school together. We drew pictures, made up stories, wrote book reports, and solved chemistry problems. When she went away to college and got straight A's, I realized she didn't need so much help. The kid turned out well. She has a clear head and a good heart. But it wasn't until she was in high school that I realized how much she was like Marie. One Sunday morning, I was sitting in the kitchen, sipping tea and musing about life. Marie was up in bed, sleeping off the effects of the night before. I was watching the sunlight refract through the window when Sophie came downstairs. "Good morning, Dad," she said. "Where's Mom?" "She's still sleeping," I said. "Would you like some breakfast? I made some oatmeal." "Not yet," she said. "I'm going out for a run." And then I saw that she was dressed for a run. I saw her long legs and slim butt outlined in those stretchy tights. Standing in the kitchen, she bent over at the waist as if she was going to touch her toes and shook her hair down with the help of gravity. Layers of colors tumbled towards the floor and hung suspended in the sunlight. Then she funneled her hair through her hands, stood up straight, and formed a ponytail. With her long, slender fingers, she slipped the ponytail through the cloth-covered rubber band. Her fingers gave the band a half twist and slipped the ponytail through again. "I'll be back in 30 minutes, she said as she headed out the door. I walked over to the window and watched as she ran up the street with long, easy strides. Her ponytail swung back and forth with the rhythm of a metronome. Pretty hair, long legs, beautiful hands, and a good heart. Sophie was just like Marie, except for the drinking. At first I thought I could change Marie's habit. Then I thought I could control the problem. Finally, I just tried to shield my daughter from the worst aspects. That's how you survive a difficult marriage. Lower your expectations. But the whole thing wore me down. A month after Sophie left for college, I moved out. 1 year later, I filed for divorce. I'm glad Marie quit drinking, but she waited until it was too late, for her and for me. During our marriage, I was never very good at saying no, but this time I would. I was ready when she called. "Hello," I said, sensing this was the call I was waiting for. "Hello, Frank," Marie said. "Do you have a minute?" "Sure," I said. "This is a good time to talk." "First of all, I want to thank you," she said. "My doctor told me that you spoke with the transplant team." "Yes," I said. "I spoke to a lot of people at the hospital. Of course, the first step was the blood test. Frank, I appreciate what you've done already. It means a lot to me." "I didn't do that much. I just took the test and talked to the doctors." "Did your doctors tell you about the test?" "No," she said. "Are we compatible?" "Well, one doctor offered to lie for me and say that our blood wasn't a good match. But the truth is, you are type A and I'm type O. We are compatible. In fact, I'm compatible with everyone." "Oh, that could be good news for me. Have you thought about my request?" "Marie, I thought about it a lot. If you needed a kidney, I would do it. I really would. Frank, I know I'm asking a lot, but I'm in trouble. I'm afraid. I'm afraid I'm going to die. A lot of people die while they're waiting for a dead donor. And some people die as living donors. Frank, I know there's a risk, but I need your help. Please, just think about it some more. If you decide not to do it, I'll leave you alone. I'll try my best to find another solution. Maybe I'll ask Sophie. I felt like I had the wind knocked out of me. I knew Sophie would say yes. That's the kind of person she is. When I got enough air into my lungs to speak, I told Marie that I needed more time to think about it, that I would call her in 2 weeks. Okay, that's the case. Now here's what I'm going to do. I'm going to divide you into small groups of 3 or 4 people. I want you to take 10 or 15 minutes, and I want each group to identify the ethical issues in this case. Now you can speak in Mandarin, that's fine with me. But then we're going to present what the ethical issues are, so at least one person in your group has to tell me in English. Okay? So you 3 be a group. 1, 2, 3. I would like you 3 to be a group. 1, 2, 3. 1, 2, 3. You make a group. 1, 2, 3. Perfect. How about 4 back here? And 1, 2, 3, 4. You 4 form a group. Okay? If you want, you could move a chair around here. And Daniel, you can join any group you'd like. Okay? Now, here's what I want. A list of the ethical issues. You don't have to solve them. We'll solve them together. But the hardest part at the beginning is to identify different ethical issues. Okay? So that's enough instruction. If you have questions, you can ask me. Okay? So please begin work.
反正他就是简单的就是用前期要
就是说他，
反正他在说的是他的前期跟他女儿应该算很像的。
And then I think Marie is kind of using this as an advantage to force Frank in a way that asks him to donate his liberty.
Yeah, I think you're right. That is, she's sort of threatening Frank. So what's the ethical issue? Should she do that? Should she threaten to ask her daughter to get her ex-husband to say this? Okay, that's a good issue. But I think there's some other issues in there. So look a little more. There's an issue about her drinking, right? One of the doctors offers to lie. A few other things you might think about. There's a shortage of organs.
Hospital asks people, can you introduce about this kind of job or what? And mention about this job.
Well, some hospitals have people who work in ethics and talk about ethical issues. Doctors or patients or families.
So they are philosophers?
Some are philosophers, some are medical doctors, but they all have some expertise in ethics. Okay? Now, have you got some ethical issues identified? What did you come up with? Oh, I don't see any written down.
Well,
so what's the biggest ethical issue in the case?
I'll try. I think it's about a surgery. Maybe it's just between patient and she asked for the liver for make her living. Right, but this issue becomes a family problem. Yeah, because the husband knows if he wants to donate part of his liver, then maybe his ex-wife will ask for her daughter. Then that will make her daughter realize what kind of life between him and her ex-wife. I think the most common ex-wife maybe a little bit alcoholic abuse, sometimes, and she trying to not show about this part and hide all the aspects of these truths. But if the surgery going on, and this kind of thing will recover to her daughter. So it's between it's become a problem about their family relationship.
I think that's certainly one ethical issue. I mean, I think the biggest is, should Marie threaten to ask the daughter, to try to get the ex-husband to donate? And there's an issue about the drinking, too. Okay, we'll write those down. What did you come up with? A lot of people miss that.
可是我觉得他真的很棒，他说用2欧成绩的费用，这样很高。因为他不是就是做测试，就是你是 A 型，就是他说他做完结果是你是 A 型，我是 O 型，所以我觉得但是我觉得这个 OK 啊，因为我觉得他这样。
And then I guess another issue is Marie is threatening to ask the daughter, right? That kind of puts pressure on the family. There's a question whether that's right. List of issues? Okay, I don't see the list. Is it in your head? Oh, okay. Give me one example. I'd like to begin again. Now, I just want to generate a list of the different ethical issues, and then we will pick some of them and analyze them. So let's start with your group. Tell me just one ethical issue in the case. One, not all of them.
Yeah, we have the issues like, can the doctors ask their clients or ask their patients to hide the truth from the third party?
Okay, explain a little more. How does it come up in the story?
Yeah, because in the story that explains that, you can see at the reverse side of the story that it says, well, one doctor offered to lie for me. In this case, that maybe the Frank can just simply say that no, my blood type is not A nor B, so I can just simply say that we are not compatible. But under this situation, that the doctor is just asking Frank that you can try to lie to your ex-wife.
Okay, more than that, the doctor offers to lie to the ex-wife. So is it right for the doctor to lie or offer to lie? This is not a made-up issue. I can say that in the United States, some doctors, they test family members, and family members, some really don't want to donate. And the doctors try to make it easier by saying, okay, we will tell your family that you're not compatible. It's a kind of lie, because the family understands not biologically compatible. That's what anyone would understand. but the doctor sort of means it's not psychologically compatible because he doesn't want to do it. But it's a kind of law. Your group, could you tell me an issue you came up with?
While Frank and Marie were divorced, and can Frank appoint Marie to be his liver's recipient? Because in Taiwan, while if you are not couple anymore, and you cannot appoint your ex-wife or ex-husband to be your recipient.
So in Taiwan, there are strict regulations about living donation, right? So I can't just donate to you, but of course I could donate to my daughter, or my daughter could donate to me. There has to be in Taiwan a certain kind of relationship, okay? So we'll put that down. I'll put I'll just write one word. It means relationship. What kind of relationship should there be for a donation? Okay? It's a little different in the United States. We allow friends to donate to one another. There's even a few cases of strangers donating to each other, but they're not allowed to exchange money. Okay? Same in Taiwan. There's not supposed to be any money exchange. Let's hear from your group. What did you get?
We think the main issue is about something like if you can save other people's lives, especially this one have a close relationship and intimation with you before, can you say no? So that's why I think the Frank want to talk about their divorce, and the divorce lawyer want to talk about obligation between the marriage, and why he want to talk about the hospital ethics, about some ethical issue. That she trying to find that kind of way to give him an answer. Yeah, but I think the main problem who bother him is I have said before. Yeah.
Okay. It's hard to write in one word. Should Frank say yes? Okay. Should Frank agree? Now there might be different reasons. He could save Marie's life. He could protect Sophie's. But the question is, on what basis should he make his decision? So I think you're getting at that.
I think the main point is you got a chance to save one's life, but can you say no?
Okay, well, should Frank agree to save someone's life? Yeah. But it's more than that, because he's looking at the relationship. I mean, there may be some stranger I could save that person's life, but you don't think I have to give half of my liver to a stranger.
So another main point is about they have the intimacy before.
Yeah, yeah. And it's harder because they're divorced now. If they were still married, I think we might change. So let's hear from this group.
We think that it's like, since we both know that Marie and Frank, they all agree that Sophie would say yes to donate her liver to her mother. Then Marie is kind of like taking advantages of this point and threatening Frank to kind of like say yes in order to protect her daughter from donating, or I would say take the risk of like 1 out of 200 that might make her cause her daughter to death.
Yeah, I think you've got it, the biggest issue in the story. That is, Marie is threatening to ask Sophie to try to get Frank to say yes. So he's putting pressure on Frank. Frank doesn't want to do it, but he does want to protect his daughter because they all say, she's such a good heart. She will do it for her mother. But she's a young person. It doesn't tell us. In college, let's say 20 years old. She could die during the operation. Okay, so I'll put, should Marie Breton Okay, let's hear from the group in the back. Are there any, it's a little harder when you're at the end, but are there issues?
Because we are in the end of the
Yeah,
so
sorry.
all of us already mentioned the points. Actually, I would like to say the 4 points. That's just like, should Mary use this advantage to threat Frank to donate the liver? But I got another one question is, okay, now they are still in a relationship. They didn't divorce. So is it legal in this kind of situation or obligation should Frank to donate to Mary?
Okay, so you're changing the case,
Yeah,
which
I
is
changed the
okay.
case, yes.
Lawyers do this all the time. They start with one case, right? And then the professor says, well, what if I changed it this? And then you have to analyze that. And we do that in ethics too, but I don't want to change it yet. But you're certainly right. The closer the relationship, the more obligation, okay? So if you're married, then you have stronger obligations than if you're divorced, okay? And you can think about it in another way. There's lots of things you can donate, okay? You can donate blood. So if I needed a blood transfusion, how many of you would donate blood to help me? Give 1 unit of blood. See the hands. Well, thank you. Okay? You all get A's. And who would not donate blood? Some people didn't answer. Now I'll make it harder. I'm just, you just met me today. Suppose I needed bone marrow. Bone marrow is the stuff inside the middle of your bones. They sometimes need a bone marrow transplant to treat leukemia, other diseases. What they do is they stick a big needle into your hip bone. They anesthetize it, so it's not so painful. But inside your bone, and then they suck out some bone marrow. It's not so risky. There's a needle stick, it's a little sore, but it's more than blood. So if I needed a bone marrow transplant, how many of you would give me bone marrow? Very altruistic, thank you. But fewer. And now it's going to be easy. Kidney, I need a kidney transplant. You have 2. How many would give me one of your kidneys? No. And liver, no. Now we're going to change it, like your law professors do. How many of you have sisters or brothers? So your sister needs blood, and you're the same type. How many would donate blood, 1 unit for your sister? Of course. If you refused, we'd say. Now, bone marrow transplant. Yeah, almost everyone. See, it changed with the relationship. Now it's a little harder. 1 kidney. You have 2 healthy kidneys. How many would give a kidney? Wow, very altruistic. How many don't know? Yeah. Well, you're honest. Okay? Now it's a little harder. Your sister needs a liver. You read the risk, okay? They want to cut out half your liver. How many would agree to donate? Wow, very strong. Okay, I'll go further. Your sister needs a heart. They cut out yours, you die. How many would donate your heart to your sister? I didn't think so. Okay? So look, it's a serious matter, but what we all agree upon, the risk matters, but the relationship matters too. And I think you're right, this case is problematic because the relationships are unusual. We have a divorce, but then we still have a daughter, which is both their daughter. Yeah. Okay. On your list, we don't have to go around, I'll take the microphone. Are there any other ethical issues that we haven't identified yet, that you came up with in your group? I had a couple more on my list, I'll tell you, but was there anything on your list? Okay, well, here's a couple more issues. We'll put it over here. We'll come back to this. Marie needs a liver because she drank too much alcohol for years and years. Okay? And the question is she responsible for the damage she did to her liver? And the way it comes up is in a society like the United States and Taiwan, there are not enough organs for everyone who's waiting. So in the United States, if you look at all the people waiting for livers, about half of them are waiting because they have cirrhosis of the liver caused by drinking, or they have hepatitis. Hepatitis can be transmitted different ways, but one of the ways it's transmitted is drug use. Okay? It can also be sexually transmitted. So now the question is, we live in a society where there are not enough organs, and there's all these people waiting on the list to get livers. Question, should we treat the drinkers and the non-drinkers alike? Or should we give priority to the non-drinkers? They have some disease, biliary atresia. Okay? That's a big ethical issue. We'll come back. One more issue, the shortage. Why does Marie have to ask Frank? It's because there's not enough livers. There's not enough dead donors. Now, why aren't there enough dead donors? This is a complex policy question. But in the United States, like Taiwan, if someone dies, they have to agree beforehand to be a donor. They fill out a card, they're a donor. Or their family has to agree. Yes, my son, my brother died, we will donate his organs. That's the way it works in the United States and in Taiwan. So that means you have to ask for it, and the patient beforehand or the family has to agree. Some countries do it differently. Singapore, some European countries, they change the default. In Singapore, you are an organ donor, period. If you don't want to be, you have to opt out. In the United States, it's the opposite. If you want to be an organ donor, you have to sign up, and your family has to agree. Not so. In Spain, let's take Spain, you are an organ donor if you are in Spain, period. Spanish citizen. If you don't want to be, you have to go down to the Ministry of Health and fill out a card and opt out. Furthermore, in Singapore, if you opt out, you can't receive an organ. You're taken off the list. Singapore always does things differently. You know, they're very strict and rigid. They don't mess around like the United States and Taiwan. Okay? They just say, you know, you want an organ, you have to be a donor. You're a donor. You have to opt out. Now, there was a special rule in Singapore about certain religious groups, but I won't go into that. So an ethical issue is, in the background of this story, is this policy that we don't even see. And the question is whether we should change the policy. Okay? Well, good. I think that's a very useful list. So what we'll do now is we'll briefly discuss some of the issues, and we'll try to get to the main one. But since I mentioned it, let's start here. And I'll give you 3 choices. There's different policies you could adopt in Taiwan. So the current policy is this. You have to sign up, or your family has to agree to be an organ donor. Okay? Second policy is we could require that doctors ask every family, if a patient dies, to be an organ donor. Some of the doctors don't ask because it's very hard to ask. Someone has just died, like a young person in a motorcycle accident. We go to the family, we say, we're very sorry, your son died. We did everything we could, but the head injuries were too great. And now we're supposed to ask. There is something you could do to help others. Would you agree that your son become an organ donor, and then we take the kidneys and the liver and we give it to other people? Some doctors ask, some families agree. You could increase, and this is being debated in Taiwan, we will make a law that says doctors must ask. Families can say yes or no, but doctors must ask. Third is what I'll call opt-out. You all are all organ donors in Taiwan. Welcome. If you don't want to be, when you're 18, you have to go down to the Ministry of Health and fill out a big form and carry it around in your wallet that says, I am not an organ donor. Okay? So now I want to ask you, how many like the way it is in Taiwan? Keep it as it is. How many say, keep it as it is, but require that doctors ask families? Okay, so that's trying to increase it. How many are more radical and say, opt out? You're all organ donors unless you opt out. Yeah. So tell me why. Why you favor the opt-out policy? Just a few reasons. I was looking at you as you raised your hand.
I don't want my family to.
Oh, I'm sorry. They're recording this.